Hello, everyone. I'm Dr. Vivek Venkat, consultant uro-oncologist and robotic surgeon in Mumbai. Thank you very much for joining us. And today we'll be just covering a few basics regarding prostate cancer. Prostate cancer is an abnormal growth within the prostate. The prostate is a small walnut-shaped gland situated just below the urinary bladder, and its important functions are in the reproductive age of a man. Prostate cancer, unfortunately, is a very common cancer and its incidence is only rising. It is the second most common cancer in the world, and about 1 in 8 men will be affected with prostate cancer during their lifetimes. Every 15 minutes, a person dies of prostate cancer. That is how common it is. The risk factors for prostate cancer include age. India is now an aging population, and with the rising life expectancy, the incidence of prostate cancer is also expected to increase by leaps and bounds. Other risk factors include smoking, a strong family history, as well as the African race. In the early stage, there are often no important signs or symptoms of prostate cancer. Later on, one may develop symptoms of urinary obstruction, including difficulty in passing urine, interrupted flow, increased frequency of urination, as well as blood in the urine. In more advanced stages, a man may notice a loss of weight or appetite, or if the cancer has spread to the bones, there may be pain in the affected bones. Unfortunately, prostate cancer is not a preventable cancer, but it is something that can be actively sought after, and numerous countries run national screening programs in order to catch prostate cancer at an early stage. Most national cancer agencies, like the American Cancer Association or the European Cancer Association, recommend an annual simple blood test called the PSA test to all men above the age of 55 in order to catch prostate cancer at an earlier stage. This is done once a year, and initially, if the levels are very low, we can even tailor the frequency and make it less often. For those with a strong family history, sometimes the PSA is recommended to be done even in the age group of the 40s. If the PSA is elevated, further tests like an MRI or a biopsy may be needed. And if the biopsy shows cancer, a PET scan is often done to stage the disease. The treatment depends on the stage. In early stages, surgery and radiation are excellent options, while in more advanced cancers, hormone therapy and chemotherapy can control the disease for a long time. Thankfully, prostate cancer generally has a favorable outcome and is extremely curable in the early stages. So to conclude, I would like to say, always consult your doctor for all men above the age of 50 or 55 and check whether you should undergo prostate cancer screening, because this, if detected in an early stage, is extremely curable. Thank you all for listening.